Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about another anticoagulant, that is heparin. We have discussed about what are anticoagulants, how do they function, what are the side effects, what precautions we need to take when we are on anticoagulants, etc. But heparin and warfarin, these are the two most commonly used anticoagulants. So let us discuss in brief about this anticoagulant, that is heparin. Heparin is an anticoagulant. Okay, it prevents coagulation. So it will thin your blood. So it is a blood thinner. Okay, so this will prevent the formation of new blood clots. Okay, and it will also prevent the existing clots from becoming larger. जो ऑलरेडी क्लॉट्स है उनको बढ़ने से रोकता है एंड नए क्लॉट्स फॉर्म होने का वो रोकते रहता है. सो यूजुअली हम हेपेरिन को इंजेक्शन के फॉर्म में देते हैं एंड व्हेन वी वांट टू प्रिवेंट दिस क्लॉट्स, टाइनी क्लॉट्स, may it be in the heart, may it be in your lungs, may it be in your limbs, may it be in your brains, we usually use this heparin. So now how does the heparin work? So heparin will not dissolve any existing clots. Agar already there are clots, it is not going to break those clots. Okay, it will prevent the formation of new clots and also it will prevent the clots from getting larger. And how it does this? It will activate the natural anticoagulant, that is your antithrombin 3. And this will significantly increase its ability to inhibit the other clotting factors. Okay, so you will see that this heparin will activate antithrombin 3. This antithrombin 3, what it will do? Antithrombin, it will prevent the activation of thrombin. So if thrombin is not formed, then the fibrin also will not be formed. So antithrombin 3 will inhibit the conversion of prothrombin to thrombin. So if thrombin is not formed, there is no conversion of fibrinogen to fibrin and hence there is no fibrin or no clot formation. Now heparin is available in two forms. One is the unfractionated form and the other one is a fractionated form. So unfractionated form is the heparin which is derived physiologically. Okay, so this is your unfractionated form. So usually the pork is derived physiologically. So you have high molecular weight heparins and the fractionated form. This is the unfractionated heparin undergoes a process and wherein you will get a low molecular weight heparin. This gets, the high molecular weight heparin gets depolymerized and then you get the low molecular weight. So these are the two forms and there are differences between these two. We will look into it, but remember there are two forms of this heparin. So unfractionated, it is not broken into pieces, that is the high molecular weight heparin, and the fractionated, that is your low molecular weight heparin. Now, what is the difference between unfractionated heparin and this fractionated or the low molecular weight heparin? So unfractionated, it's a long chain. So what it will do, it will activate antithrombin 3, which forms a complex inhibiting the clotting factors like 2A, 10 as well as 9, 11 and 12, etc. So you will see that when we discuss about the clotting pathway, you have intrinsic pathway as well as the extrinsic pathway. So extrinsic pathway is whenever there is an external injury, that will stimulate your extrinsic pathway, and the main factor here is a factor 7. Okay, and the PT measures this extrinsic pathway. And from this factor 10 onwards, you will have the common pathway. Okay, so this will help in the conversion of prothrombin to thrombin. So this extrinsic pathway and the common pathway is measured by PT, which is around 11 to 14 seconds. Now the intrinsic pathway begins with factor 12, then you have activated factor 11, then you have activated factor 9 and activated factor 8. So this is your intrinsic pathway, and your APTT will measure your intrinsic pathway. What happens is when the thrombin is activated, the thrombin, what it will do, it will help in the conversion of fibrinogen to fibrin monomer, isn't it? So this action, other than this, thrombin also activates factor 5, and factor 5 activates factor 10. Thrombin also activates factor 8, and factor 8 activates factor 9. Thrombin also activates factor 11. Thrombin also activate factor 13. So now when you activate this, it is required for the stabilization of this fibrin clot. It causes the cross-linking of this fibrin fibers. So thrombin is very important. Why APTT is used to measure intrinsic and this common pathway? Because I have told you this thrombin. Thrombin activates factor 8, that activates factor 9, so intrinsic pathway is affected. Thrombin activates factor 5, that affects factor 10, so the intrinsic pathway is affected. Hence APTT is used to measure the intrinsic pathway as well as the common pathway. That is what the heparin does. It will activate the antithrombin, which will block the thrombin, and hence the clot formation is stopped. This unfractionated heparin is having longer chain, so it will activate antithrombin also, and also it will inhibit clotting factors like factor 9, factor 10, factor 12, etc. Whereas the low molecular weight, it is a fractionated fraction. Okay, so it is only going to activate your antithrombin 3. When we talk about mode of administration, unfractionated heparin, we usually give it intravenously, whereas low molecular weight heparin can be given subcutaneously. Unfractionated heparin has a shorter half-life, almost an hour, whereas the low molecular weight heparin has a longer half-life. Now the side effects of this heparin, unfractionated heparin, it can cause bleeding, it can cause osteoporosis, it can cause heparin-induced thrombocytopenia, hyperkalemia. It will inhibit the aldosterone. And same thing with the low molecular weight. It can also lead to all these complications. The reversibility, in case of unfractionized heparin, we can easily rapidly reverse this action of this unfractionated heparin by protamine sulfate. Okay, and this action of low molecular heparin is partially reversible. Now this unfractionated heparin, it is primarily cleared by the reticuloendothelial system. So if the patient is having any kidney problem, kidney failure, etc., you can give this unfractionated heparin. Whereas this low molecular weight heparin, you should not give to any patients who is having kidney problem, especially if the GFR is less than 30. You should not give because it will increase the risk of bleeding. So the risk of developing heparin-induced thrombocytopenia, it is higher compared to the low molecular weight. So the advantages of unfractionated heparin are that it is physiological, it is low cost, it is immediately acting, and it has been studied. There is a long history of successful clinical use, rapidly reversed by this protamine. Low molecular weight, what is the advantage? There is no monitoring which is required, except in a very selected cases we need monitoring. Otherwise, we don't need rigorous monitoring of low molecular weight heparin. Subcutaneously, we can inject it. You need not enter the vein every time. It has a lower risk of developing thrombocytopenia. It will decrease the platelet adhesion. It will decrease the risk of osteoporosis, and it has a longer half-life. So these are the advantages of low molecular weight heparin. That makes it much user-friendly. Okay, but the disadvantage of low molecular weight heparin would be it is the cost. So definitely the cost is higher. It's an anticoagulant, so the risk of bleeding is always there. Yes, some risk of developing heparin-induced thrombocytopenia is also there. Hypoaldosteronism, it will reduce the aldosterone. and patients who are having renal insufficiency, we cannot use them, or we can limited use of this can be done in the patients with kidney disease. So that is a disadvantage of this low molecular weight heparin. What is the disadvantage of this unfractionated heparin? This has to be given only intravenously, so that is very cumbersome. We will have to monitor it rigorously, so frequent blood tests are required to monitor this. There is increased risk of developing heparin-induced thrombocytopenia. It can cause platelet activation. So that is the disadvantage of this UFH. Heparin cannot be absorbed by your digestive system, so we cannot give this in a form of tablets, capsules, etc. It has to be given by injection, either IV or subcutaneous, or you have IV catheter flush. Okay, low molecular weight, I've told you it can be given by subcutaneous injection. That makes it very user friendly, whereas your unfractionated heparin has to be given intravenously only. What are the uses of this heparin? Where do we give this heparin? So heparin usually is given in to prevent the thrombosis, deep vein thrombosis. Patients develop this thrombus formation in their limbs, so that to prevent that we give them in deep vein thrombosis. To prevent the pulmonary embolism, blockage of the vessels in the lungs. Clot in the limbs can travel and block the vessel in the lungs, causing death, pulmonary embolism. To prevent that we give certain heart condition. Patient has developed heart attack. He has developed severe chest pain. There is atrial fibrillation. To prevent the dislodging of these clots to other parts, we give this heparin. Stroke. To prevent the clot in the brain, we give this heparin. Peripheral arterial embolism, heparin is given. Disseminated intravascular coagulation, so that it will prevent the clotting phase, okay, and preventing the abnormal blood clotting, we give heparin. During the medical procedures, during surgery, when we want to prevent the blood clots during and after surgery, we give this heparin. Dialysis patient, that will prevent the blood clot during the kidney dialysis. Patient is having this extracorporeal circulation, like heart lung bypass machine, etc. When we are using cardiac surgery, when we are performing, heparin has been given. Medical devices, when we are using like balloon pumps, etc., we use this heparin. Catheters, when we are using, small amount of heparin are used to prevent blood clots from forming inside the IV catheters. And definitely for in the laboratory use for blood collection. We use heparin bulb very frequently in the laboratories. Heparin comes with certain side effects. The common side effects would be, minor bleeding. It could be bruising easily, nose bleeds, bleeding from the gums, or bleeding while brushing your teeth, etc. Sometimes a reaction at the injection site, irritation, pain, redness, soreness, etc. There might be increase in the liver enzyme. That is usually temporary. Once you stop the medicine, they'll come to normal. Sometimes patient also complain of hair loss. Maybe heparin will affect, or because of its anti-mitotic activity, it can interfere with this hair growth phase and can cause hair loss also. Serious side effects could be severe bleeding, internal bleeding. Patient can vomit blood. Patient can have black or tarry stools when he is bleeding inside the GI tract, heavy menstrual bleeding, persistent headache when he has intracranial bleeding, coughing up of blood. So these are the serious side effects. And one of the side effects of this heparin is heparin-induced thrombocytopenia. It's a serious immune reaction. What it does is that it will lower the platelet count, and that can be very life-threatening. Okay, so patient will have symptoms like swelling or redness in the arm, legs, sudden numbness, loss of vision, loss of speech, etc. So the immune system here, what happens is it mistakenly creates antibodies against this heparin and this platelet fraction 4. And this antibody to this platelet fraction 4 complexes, and that will activate more platelets, leading to their clumping and decreasing their number, causing thrombocytopenia. So you can see here the heparin and this platelet fraction 4, and to this complex you have developed antibodies. So this antibodies will cause more and more platelet to aggregate, and then the platelet consumptions and thrombocytopenia. Some patients also have very severe allergic reaction, anaphylaxis to heparin. Some develop hyperkalemia because it suppresses aldosterone, and also osteoporosis. With the long-term use of this, your bones also become weak and brittle. You should not use heparin if there is an uncontrollable active bleeding or history of heparin-induced thrombocytopenia. You have severe thrombocytopenia because it can again reduce your platelet count. You have an active ulcer, there is a risk of bleeding. You have a recent brain, eye or spinal surgery, there can be a risk of bleeding. You have a bleeding disorder like hemophilia. You have uncontrolled blood pressure, high blood pressure. One is the pressure of the blood flowing in the vessels, and also the anticoagulant property of heparin can increase the risk of bleeding. You have severe kidney or liver disease. All these are contraindications, or wherein you will have to use this with precaution. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.